South Korea is the 13th largest OECD economy, with a land area of over 100,300 square kilometers and a population of over 51.7 million people, all of whom receive healthcare provided by the National Health Insurance Service. As the global spotlight fell on Korea's rapid pandemic response, so did interest in our healthcare system and what makes it so unique. Insurance premiums are paid in proportion to income, but everyone receives the same welfare benefits. And for every claim that goes through the National Health Insurance System, the Health Insurance Review and Assessment Service, HIRA, conducts thorough reviews of the claim and the treatment received. HIRA is the heart of Korea's National Health Insurance Service. "20 years since its foundation, HIRA played a critical role in Korea's COVID-19 fight. And as our national health insurance system grappled with issues such as minimizing financial burden, HIRA was working to keep the system running smoothly."
HIRA conducts claims review and quality assessment to check appropriateness of medical fee and the level of healthcare services. In addition, HIRA establishes standards for essential healthcare services to be covered by national health insurance.
All registered healthcare providers, medical institutions, and pharmacies are enrolled in the National Health Insurance Service, to which a large portion of their patients' hospital bills are charged. From ministry authorization to safety and validity checks by the National Evidence-Based Healthcare Collaborating Agency, medical procedures, materials, and meds are thoroughly checked before registration as a benefit. Medical expenses run on a fee-for-service payment system where medical institutions and pharmacies are paid a preset amount for each service. HIRA closely monitors claims, starting with allowing healthcare providers to course-correct treatment themselves, then a multi-step review process including electronic review, AI review, and peer review, and lastly, review notifications and on-site visitations to verify claims and prevent duplication. HIRA's main goal is to ensure that patients are provided with care that is necessary and that what they pay for is cost-appropriate. This is why on-site investigation is an important step. Validity of medical claims is closely examined and monitored with a visit to the target provider. In order to bring a standard level of care across medical institutions, HIRA has been implementing medical quality of assessments since the year 2000. These assessments push healthcare providers to provide quality care and helps people choose medical institutions befitting their needs. Quality assessments have had a notable impact, cutting prescriptions for cold antibiotics and injections by almost half, and significantly reducing number of drugs in prescriptions and acute stroke mortality rates. HIRA is also in charge of registering and managing personnel, facilities, and equipment of healthcare providers and pharmacies. Playing a key role in Korea's COVID-19 response is the DUR, Drug Utilization Review System, which is supported by HIRA's technology at their nerve center, the ICT Center. Here, patient lists from the Korea Disease Control and Prevention Agency were checked against the DUR system, and ITS, the International Traveler Information System, keeping some 98,000 medical facilities, emergency services, and pharmacies apprised of COVID-19 cases. The DUR system is crucial in tracking transmission rates and containing infection.
Under the umbrella of a national health insurance system, HIRA collects and manages national health care data in real time. That is how HIRA could do far-reaching responses such as early detection, treatment, and spread prevention during serious pandemic.
The ICT system is an integral part of HIRA. This world-class system has optimized processes and kept healthcare databases in sync. It's the brain behind strategic purchasing, quality in healthcare, health resource management, and more, not to mention agile responses to pandemics. The ICT system is dedicated to financial sustainability, cost competitiveness, patient safety, and transparency. It's capable of early infection disease detection through real-time information shared between healthcare providers and government agencies. When COVID-19 hit, medical institutions and pharmacies were promptly made aware of information on overseas travelers through the DUR system. Early detection and response to COVID-19 was achieved through data acquired by DUR and ITS systems, which were processed by the DUR department. Patients are only allowed through hospitals after they are cleared by the DUR system interface at kiosks, where they enter their resident registration number. Then, the International Travel Information System automatically retrieves travel and trace data of the patient. Medical professionals find the DUR system extremely useful in their everyday practice as well. It provides real-time access to past prescriptions.
이런 시스템이 있어서 저희가 혹시 특히 다른 병원에서 이제 진통제나 그런 약제들을 중복해서 드시는 분들을 저희가 그 진료 중간중간에 바로바로 확인할 수 있는 장점이 있습니다.
HIRA's use of the DUR system was highly efficient in testing and tracing to prevent the spread of COVID-19, but also in efficient treatment. The Health Insurance Review and Assessment Service has a system in place to track the real-time availability of negative pressure rooms in medical facilities nationwide. When one hospital is short, patients can quickly be transported to another with negative pressure rooms on standby. COVID-19 is known to be transmitted through direct contact with respiratory droplets, so masks are vital for protection. High demand led to mask shortages, but these issues were quelled early with a state-mandated 5-day mask distribution system, and masks were rationed equally at reasonable prices. HIRA's DUR system presented a method for Korea's citizens to purchase masks on days designated by birth date, preventing hoarding and overlap. HIRA works in cooperation with international organizations such as the WHO and OECD to share its expertise with countries all over the world. In 2018, HIRA consulted for Malaysia's health ministry to develop an improved framework for its medical audit system and assessments for medical technology. In 2017 through 2019, HIRA successfully implemented its ICT-based management system to Bahrain and oversaw initial operations. The Sehati IT project in Bahrain was a model example of HIRA's capabilities. It's the world's first successful export of Korea's health insurance system and management to a country overseas.
With cooperative efforts, Bahrain constructed a foundation for stable financial management, effective drug distribution, and medical data collection at the national level. This project serves as a proud example of international cooperation in the healthcare sector.
In May 2020, some 90 health professionals worldwide took part in a video conference hosted by HIRA. They discussed COVID-19 strategies with HIRA's ITS, International Travel Information System, Negative Pressure Room Monitoring System, and Mass Distribution System taking center stage. In October 2020, HIRA invited the WHO, OECD, and other global leaders in healthcare to take part in the International Symposium, COVID-19 Pandemic, Balancing a New Normal by Enhancing Healthcare Systems, just one of many international cooperation projects headed by HIRA.
HIRA is putting priority on national health and people's safety. In order to achieve national health and people's safety based on a rational and solid healthcare system, we take initiative in utilizing and expanding of ICT-based infectious disease response system.
Focused on placing people's health and safety first. Committed to improving standards of healthcare with an exceptional ICT system. Dedicated in bringing sustainable, quality health coverage for all. HIRA, the Health Insurance Review and Assessment Service.